Good morning student, this is Dr. Ritu. Today, a topic of discussion is about basic concept of pharmacology. Pharmacology, a term derived from two Greek words, pharmakon and logos. Meaning of pharmakon is poison in classic Greek, but drug or medicine in modern Greek. The meaning of logos is study or science. So, pharmacology means the science of drug or the study of drug. Now we discuss the definition of pharmacology. It is the science that deals with the study of drug and its effect or action on biological system. In other words, we can say that pharmacology can be defined as the study of the interaction of biologically active agent, that is drug, with living system. Okay, so now we discuss the historical background of pharmacology. The Rudolf Buchem is considered to be father of pharmacology. Rudolf is the originator of the experimental pharmacology. A well-known student of his was Oswald Smitheberg, who was to become the founder of modern pharmacology. So, Oswald is considered to be father of modern pharmacology. Father of modern pharmacology. Sir Ramnath Chopra, father of Indian pharmacology. He was a pioneer in the field of indigenous drug of India and an outstanding luminary in the field of medical education and research. In India, Sir Ramnath Chopra was responsible for the development of pharmacology. Pharmacology is the study of drug. So, in the pharmacology, drug is used for four purposes. Drug is a chemical substance used in the treatment, cure, diagnosis and the prevention of disease. So, four purposes drug are used, that is prevention of disease, treatment of disease, cure of disease and diagnosis of disease. Prevention of disease is a procedure through which individual, particularly those with risk factor for a disease, are treated in order to prevent a disease from occurring. Okay. Next, that is treatment of disease. Treatment normally begins either before sign and symptoms of the disease occur. Next, that is cure of disease. The term cure means that after treatment, the patient no longer has that particular condition anymore. And the last, that is diagnosis of disease. So, in the diagnosis of disease, drug administered to patient in order to diagnose or study the pathology of medical condition, disease or syndrome. So, some example regarding this, that is prevention of disease, are tetanus, polio, rabies and BCG vaccine. So, in this all disease, the drugs are used for prevention of disease. The second, that is treatment of disease. So in the case of fever, in the case of common cold, the drugs are used to reduce the effect of the disease. So in this case, the treatment of disease, in these conditions, the drugs are used to reduce the effect of the disease. Okay. Next, that is cure of disease. So in the tuberculosis treatment, the dot therapy is used for cure the disease of tuberculosis. Okay. Next, that is diagnosis of disease. So in the diagnosis of disease, radio contrast agent, that is iodine or barium compounds, are used, which absorb X-ray to make a picture of the affected area. So in this diagnosis of disease, these radio contrast agents are used to diagnose of the disease. General pharmacology consists of two main fields of interest, that is pharmacokinetics and pharmacodynamics. Pharmacokinetics, it is a combination of two words, that is pharma and kinetics. Pharma means drug or medicine and kinetics means movement. So pharmacokinetics is movement of drug in the body. It includes absorption, distribution, metabolism and excretion. The second term, that is pharmacodynamic, it is a combination of two words, that is pharma and dynamics. Pharma means drug or medicine and dynamics means action. So pharmacodynamics means action of the drug in the body. It includes action of the drug through cell membrane, enzyme, receptor, metal binding, etc. So these pharmacokinetics and pharmacodynamics are the two main areas of the pharmacology. The other branches of pharmacology are pharmacotherapeutics, pharmacogenetics and toxicology. So first we discuss, that is pharmacotherapeutics. Pharmacotherapeutics, the study of the therapeutic uses and effect of drugs. The second, that is pharmacogenetics. Pharmacogenetics, the study of variability in drug response due to heredity. Or in other words, we can say that is the science of understanding how genetic variability influence drug treatment outcomes. The last term, that is toxicology, study of adverse effect that occurs in living organisms due to chemicals, because drugs are chemical but all drugs are not chemical. So in toxicology, we study both adverse effect of chemical including drug on health and the conditions under which those effects occur. This is all about basic knowledge of pharmacology. Thank you.